It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is why see an eye doctor? Joining me is Dr. Michael Mandese with the Eye Institute. Dr. Mandese, just so that our viewing audience knows you're really a guy that goes in there and operates on the eye and does all this stuff, tell them your background.
Well, my background is I have been providing service at the Eye Institute for almost 18 years now. I went to University of Florida for my undergrad, studying in microbiology. Then I went on to have my doctorate at Nova Southeastern University. It's now in Davie. Then I went on to have an ocular disease and eye disease residency afterwards with a major focus on neurological eye disease. So I have been seeing all kinds of different patients from all different ages with different kinds of eye problems.
When I said eye surgeon, I was joking, but you're not a surgeon, are you?
I'm not a surgeon.
Have you ever cut on an eye?
No.
You have not?
No.
So the difference, I guess maybe it's really, excuse me, two different fields. One operates on the eyes and the other sort of treats the eyes?
I wouldn't necessarily put it in that light.
How would you do it?
Because even operating the eyes are treating the eyes in a sense. I suppose as an optometrist, we take care of the eyes. We will diagnose and manage disease up to a point where the patient needs a major surgery on the eye, at which point the surgeon can take over.
So that's why the topic of the show today, why see an eye doctor? Why should people see an eye doctor?
Well, that's a great question. Well, patients don't understand that there are plenty of eye problems as well as medical problems that will develop, and in their infancy of development, we can detect those problems even before they become an issue, treat it, and the patient will never even know that they had the issue. I can give many examples, glaucoma being one of them. Macular degeneration is definitely another one. But things as simple as dry eye disease can be caught early and prevent something terrible from happening later in life.
My wife, when she knew that you and I were going to do this show, she said, what about macular degeneration? I said, well, give us time. We'll do that too.
Right.
But when you talk about dry eyes, macular degeneration, and the various diseases, I think we've gotten started to the point where it's compartmented a little bit, and we have more specialists. Am I correct?
You are correct.
What is your specific specialty, Dr. Mandese? How do you differ from other doctors then?
Most of my patients come from the neurological realm. They either have a loss of vision that's not easily explained. That's my job, to do detection work to figure out what is causing it and come up with a treatment or management plan that will help them. Also, specific conditions that would cause double vision. Double vision can happen for many, many different reasons. We try to determine if it is a neurological issue, or if it could be cataracts, or if it could be a corneal issue, which is the front clear window of the eye. I
was going to ask, when you said, I was going to ask you for an example of the type of condition that you detect and then how you treat it. Would double vision be a good one?
Double vision's a great one because that's most of what I do.
What is double vision?
Well, it's basically, and that's a great question too, because what I get from a lot of patients is, I'm not having double vision, my vision's blurred. Well, if it's just a slight overlap of vision, it's still double, but it's perceived as being blurred. And that may be the very beginnings of a problem that could get worse and worse and worse, depending on what's causing it. So it's where the patient actually has a split of their vision, whether it just be a shadowed image or if it's two images that they're seeing distinctly. That can come from one eye or it can come from the two eyes not working together. And that's part of what I do, is to help determine, okay, is it really one eye or is it the two eyes not working together, which can be more serious.
Okay, let's talk about me for a minute. I was going to ask Dr. Darlington,
right,
who is a cataract guy. Excuse me. I was going to ask Dr. Darlington, and I will ask him too, but I want to ask you. I know I have cataracts, and I think that my vision in my left eye is not as good as the vision in my right eye. No, my vision in my left eye is better, impaired in my right eye.
Mm-hmm.
Could that also, barring the absence of cataracts, could that be a double vision problem?
If the eyes aren't working together, yes. Also, cataracts can cause double vision because when the light hits a surface, it will actually split. And so you can perceive it as being two images coming right into one eye.
Can you separate between saying, like, I'm looking at the TV monitor right now,
right?
And if on the top line it says, "I want to thank you," if I looked at that, would I see two eyes or two W's if I had double vision?
You may, or you just may see a slight overlap, and it may appear as blurred to you because the borders of that I or W may not be perfectly distinct.
Actually, I can see that pretty darn clearly.
Right.
So
that means your cataracts aren't that bad to give you that type of vision that I'm talking about.
Well, when I go to read something, if the print's real small,
right,
I have a heck of a time. And when I had my eyes checked years ago, they said that they couldn't magnify the glass the same way because of the cataracts.
Right. You're talking about... Well, these are very different sized images. So whereas you're able to see those images very well because it's a lot larger.
It's just darn big, okay.
You're talking about something else that's really tiny. Whereas, you have the font on your notes here enlarged because the smaller print is very tough for you. You're not getting a clear image coming into the eye.
So if a person is reading and you do it, I will admit, sometimes it looks like I'm seeing something double. How do you treat something like that? What do you do?
Well, it really depends on what's causing the double. If it's a cataract and it's bothering you and it's causing a problem with your daily function in life, then you have the cataract removed. And we put a brand new lens inside the eye that doesn't have that cloudiness that can cause the doubling or the cloudy vision that you have. If it's from something else, a neurological issue that we discover, be it multiple sclerosis or a brain tumor or a stroke or any other inflammatory disease that can cause these issues, thyroid eye disease is a big one also. You have to treat the underlying disease first, and then you determine what needs to be done next. Sometimes you can correct the double vision simply with glasses, and other times the patient needs a surgical fix in order to get the eyes aligned better.
It's not simple.
It's not simple. That's why there are specialists like myself to do these things, because when you talk about the average person looking at the general population, that's not what they do all day, every day.
Okay, but you mentioned, you said you were an optometrist?
I am.
Your wife is an optometrist.
She is.
Do you talk about these things a lot or not?
We do.
No, it is. You can laugh about that, but you can get serious about it, because I would suspect eye doctors see many different types of eyeballs.
This is true. Yeah, we have we have a ton of very interesting conversations, and it's kind of nice because we have two different perspectives.
That's what I was going to get at.
Absolutely, and so I don't care what kind of doctor you are. If you have two different perspectives looking at the same condition, you're going to approach it a little bit differently.
Dr. Mandese, we were talking, and I was going to ask you what are some of the medical conditions, but I'll just go ahead and rephrase my question. I want to say that when we talk about medical conditions such as blood pressure, arthritic conditions, thyroid problems, diabetes, how do all these things really impact the eye and the relationship between eye disease and other body disease? Because I think this is a topic we really don't talk that much about.
It's a fascinating topic. And each one of those have their own separate deal that goes along with it, especially, for example, high blood pressure and diabetes and other blood circulation disorders. When you have a problem that causes an issue with your blood circulation, you're decreasing the oxygen and metabolism metabolites that go to the eye and decrease its ability to function in an efficient manner. We've found that things like macular degeneration and glaucoma, the like, are certainly have a high correlation with poor blood flow in patients. There's a high correlation with cardiovascular disease and cerebrovascular disease, the same. When you talk about inflammatory problems, inflammation can show up in the eye from rheumatoid arthritis, from lupus, from sarcoidosis, as well as many other inflammatory diseases. I'll mention Sjogren's syndrome, which is on the spectrum of the inflammatory diseases, causes severe dry eyes. So if this is detected and treated properly, it can make the patient comfortable for the rest of their lives rather than suffering. This is a progressive disease, so if you stop it in its tracks earlier in life, you're certainly helping the patient. You go on to thyroid disease. Thyroid disease can cause inflammation around the eyes, can cause anything from double vision to eye pain to dryness. So certainly these are things that are important. Personally, I've diagnosed every one of these disorders, and I'll add a few more: multiple sclerosis, brain tumors, because patients present and they may even be asymptomatic, which means they don't even know they have a problem. They come in and have their eyes checked, and I say, well, I found X, Y, or Z, which can point to a specific problem. Let's check it out. Let's work with your primary care physician or an endocrinologist or a neurologist in order to help determine if you have this problem.
Let's home in on one that probably most of the viewing audience are familiar with.
Okay.
High blood pressure.
All right.
What is the significance of high blood pressure in relation to eye disease or eye problem?
All right. High blood pressure causes damage to the blood vessels. Because the eye has some of the smallest blood vessels in the body, they're some of the most fragile blood vessels.
Okay.
So these may be affected first. Your blood vessels are the highway. That brings all your oxygen and nutrients to your tissues, which are extremely fragile. Your retina in the back of the eye is dependent on having very efficient blood flow and oxygen exchange. Your optic nerve, the same. So if you decrease any of that efficiency, you're decreasing its ability to function in an efficient manner. So it doesn't have the good oxygen and nutrient exchange, so it loses energy. And this is such a slowly progressing type of situation that ordinarily you can catch it pretty early in patients. We can see changes.
What does the high blood pressure do? How does that affect the blood? What is the relation? What is the chemical change that happens?
Well, what happens is when the blood vessel becomes damaged, it scars down. And if you imagine a water hose and you squeeze it, you're decreasing the center, what we call the lumen of that hose. That decreases the flow of the blood through it. So you need all of that blood in order to deliver those
So the high blood pressure restricts the flow of
It does eventually because it damages the blood vessels. And the scar tissue inside the blood vessels causes it to decrease the blood flow.
Generally speaking, people who have high blood pressure, they're on a certain regimen of medications.
Right.
But then if you go to your cardiologist and your blood pressure might be spiking, they give you different drugs that are short-term drugs that act to bring the blood pressure down a little bit to where the normal regimen of medications will continue to sort of function on a level mainstream.
Right.
Correct?
Yes.
Are there added dangers by virtue of the fact that to the eye, if people don't do a better job of listening or going to a cardiologist and having their heart checked?
Without a doubt. Absolutely. Because you need the whole system to work properly. If everything doesn't work together, then you're not allowing the body to do what it's supposed to do.
Well, how do we make that happen, Dr. Mandese? I mean, when I was a young officer in the Navy, we got an annual physical. And every year then after until I retired, I had to get a physical.
Mm-hmm.
And they checked all this stuff. But in the civilian world, people don't seem to get annual physicals.
You know, I think that's what we're doing right now, is we're trying to educate the public in allowing them to understand that this is why you get everything checked. You don't just have your annual physical. You get your eyes checked every year, mainly because we can find things in their infancy before they become a problem and then fix them.
Is that why when I first came to you about being one of the people on the show that you wanted to do this?
Absolutely.
The education part?
Absolutely. I think that the more people understand how important their eye examination really is. I mean, this is a health evaluation in and of itself. The blood vessels that we're looking at in the back of the eyes, those come directly from your carotid arteries inside your brain. Did you know that?
No.
We're looking at brain blood vessels. We're looking at brain blood. The optic nerves in the back of the eye come directly from your brainstem. Those are brain nerves. So we're looking at things on the inside of the eye that most other physicians can't see directly.
Is that what you were getting at when you had that when you and I did the TV show before, and you had that eyeball sitting in front of you with those rays going back to the brain?
Absolutely.
That it makes sense.
Yeah. So it's not just a telescope lens system. The lens system helps focus the light on the light detection system. So you've got two systems in there that have to work in harmony with each other, otherwise your vision's no good. So if you keep the lens system healthy, that's certainly what a corneal specialist and the cataract surgeon does. You've also got to keep the back of the eye healthy, which is what the retina specialist and glaucoma specialist, as well as the neuro specialist does, in order to make sure everything's working properly.
But as a doctor that treats the whole overall picture, is what I'm getting is what you do. You look at all of it.
I do.
All right. Now, let's say that, and you've mentioned corneal implants and or retina implants. What was, you said retina and cornea, you mentioned both.
Well, I mentioned, the corneal specialist who, if the cornea is not perfectly clear, they can do different procedures in order to help with that. Certainly, you can have refractive surgery to get rid of glasses. You can have corneal transplants of different sorts. We no longer have to do as many full corneal transplants because of some of the more technologically advanced procedures that people like Dr. Darlington does.
Okay. You're sort of answering my question, but I want to be more specific about this.
Right.
What you're saying is that, I think what you're saying is that you can fix the cornea and you can fix the retina. You can do a lot of these things a lot safer, easier, and more effectively than you could say 5 years, 10 years ago.
Yes, absolutely. If you're using the more technologically advanced procedures, without a doubt.
Okay. Do eye doctors, do you have to be specialists in all these things to do these things, or what?
Eye doctors in general.
Okay.
Okay.
What is Eye Institute? I know you have a large array of doctors at the Eye Institute.
Right.
Why is it more effective to go to and I'm saying this as a layperson.
Right.
I'm believing it's more effective to go to an organization that has a retina specialist, a cornea specialist, an optometrist, a cataract guy, a person that deals in the diseases. You see the whole picture.
Mm-hmm. We work as a team. We work together. We don't compete against each other. If one of the retina specialists has a corneal problem, he sends it directly to the corneal specialist. If you do something all day, every day, and you're doing it correctly, you're going to be better at it than most other people who are trying to do it, who don't do it all day, every day. That's the point. And that's what our team approach really does for us, is it helps to elevate our expertise.
You mentioned dry vision.
Mm-hmm.
How does dry vision, how does that interact? And I've had people say, "Oh, I have dry eyes,"
right?
And they put medications in.
Mm-hmm.
What are some of the dangers of people that are doing this? They're going to a drugstore and getting eye drops, putting them in without knowing what they're treating.
Dry eyes can be caused from so many different things. It can be caused from side effects from your medications. It can be caused from hormonal changes in the body. It can be caused from inflammatory disease in the body. So really, you need to know. It can also be caused by problems with your eyelids in general. If you don't have good oil production in your eyelids, your oils aren't going to lubricate the eyes very effectively. So you really have to determine what's causing the dryness before you try to fix it. If you're just throwing Band-Aids on it every day or several times a day, it really doesn't do a whole lot to keep it from getting worse.
To go back to the title of our show, why see an eye doctor?
Well, even if your vision's fine, you still need to make sure that there aren't subtle problems that you would never know you have. You need to know that. And that way you can get these things managed and taken care of effectively.
I wear glasses.
Right.
Many times I've thought about contact lenses. And I've always been reluctant to go to contact lenses because I just didn't like the idea of sticking something on my eyeball and making you laugh.
Yes.
Do you think it's the same thing?
Well, or
do you wear contact lenses?
I don't wear contacts,
okay.
But I hear that very frequently. And contacts aren't for everybody, okay? But I can tell you that the patient who's motivated to see better without their glasses, also the patient who is motivated to have better vision even though they can't get good vision with the glasses, sometimes contact lenses can help that significantly.
Get better vision with contact lenses?
Sometimes. If they have a problem on their cornea, without a doubt, using specialty kind of contact lenses can help to smooth that out for them and give them better vision.
There's a lens that you mentioned, and I have a hard time. I'll try it again. Scleral?
The scleral lenses.
What is a scleral lens?
Well, it's actually a very large contact lens. And the reason it's called the scleral lens is because it touches only the white part of your eye. It doesn't touch the center where the cornea is, which is what you perceive as your colored part of your eye. Okay. So the fact that it touches only the sclera, the white part of the eye, the patient is much more comfortable in wearing it. These types of contact lenses are used in patients that have a cornea that's very wavy and it bends the light very strangely so that glasses won't correct it. Also, in other patients, it can therapeutically help their dryness because that contact lens is filled with fluid the entire time, all day while you're wearing it. Your eye is bathed in fluid all day, so it can actually help with dryness in some severe patients.
Being away from the eye, it keeps that pressure off?
That's right.
You make it sound like if somebody has a problem with their cornea or their retina, you can go ahead and they can surgically remove that, put a new one in now.
Not the retina. We don't have the ability to surgically remove a retina and replace it. The cornea, we can do that. We can do all different types of corneal surgeries to fix the cornea.
What can you do for the retina or anything?
Well, if you have wet macular degeneration, which is the bleeding kind of macular degeneration, there are medications that are utilized now to stop it in its tracks and sometimes even reverse it and give some patients their vision back. Okay.
Wait a minute. You're saying if a person, it might be possible if you detect macular degeneration early enough, you can reverse it?
Yes, absolutely.
I don't ever hear anybody say that.
Yeah. There are medications now that are even FDA approved to stop macular degeneration in its tracks. The wet form of macular degeneration. There are two different kinds.
Okay, wet form and dry form, yes.
Yes, the wet form is the one that bleeds. So if we detect a bleed in the back of the eye, which is pretty easy to do if you're just looking straight in, sometimes the patient doesn't even know they have it if it's off the center of their vision.
But the dry kind is more prevalent, isn't it?
The dry kind is more prevalent. It's pretty much what I consider a normal aging change in the back of the eye. Most people get dry macular degeneration. It's whether or not it's progressive or causes really an issue in the patient. That's why we monitor them so closely.
Okay, let's go back to the top of our show. You got 30 seconds to tell our viewing audience why somebody should see an eye doctor. Why should they?
I want patients to know that if you see an eye doctor on an annual basis, we can find subtle problems like glaucoma, macular degeneration, diabetes, things that you'd never know that you had, and help fix them so that later in life you won't have that problem, or it'll certainly be a lot less than it would have been.
That is very, very well phrased, Dr. Mandese. And I hope our listeners, our viewers, like I do radio and TV, and I thank you for being with me today. And I thank you, our viewer, for watching today's episode of Helping Seniors.